brought to you by Express Care Health and Skin Center. Get in, get out, get better.
All right, everybody, summertime is a time for sports, and if you're just joining us, we are talking about injuries relative to the knees and ankles. Dr. Jitka Lom is here from Express Care. We have some really good questions, ostensibly from some athletes, because they're very specific. So you ready?
Okay.
All right, here we go. Question number one from down south. Kevin in Santa Rita asks, is it worse, Dr. Lom, to turn an ankle outward or inward?
Oh, good question. Generally, it's worse to turn it outward rather than inward. If you turn it in, there are 3 ligaments on the outside of the ankle, and usually only one of those will get injured. If you turn it out, there's only 1 ligament on the inside of the ankle, and that one, when it's ripped, it's really quite severe, and you also have a higher chance of breaking a bone. So generally, if you're going to twist your ankle, twist this way.
If you're going to try to twist your, well, I also know you can also hyperextend it either down or up.
You can do that, yeah. Gymnasts tend to do stuff like that.
Oh, because of the way they pivot their ankles. Okay, good to know. Okay, question number 2 comes to us from Agani Heights, and Michael asks this one. He says, I've previously had minor ankle sprains due to basketball. Should I wear an Aircast when I play, or is that just overkill?
It's a great idea. The thing is to give the ankle extra support. So the ankle itself has support within it, but if it's been damaged in the past, it might be a little weaker. So you can use athletic tape. You should ice before you play the sport. You can take a little bit of Motrin anti-inflammatory, ice right after you play the sport. Wear the high-cut running shoes, but tied up. A lot of kids walk around and the high cuts are sloshing all around. It does nothing. So, and you could wear an Aircast, and that's all to give your ankle additional support so that it doesn't twist side to side.
Or if you're like our graphics guy, Steve, you wear those high gym socks with the 2 red stripes up top. Those are very attractive. Yeah. Okay. So, but an Aircast seriously is basically it's a very, very lightweight way to stabilize the ankle.
Exactly.
Okay. Excellent. Okay. Question number 3 is from Lisa from Talafofo, and she asks, I had surgery years ago to repair a torn ACL, which we discussed previously, from sports activity. What are the chances of my tearing it again? And I know people that have just torn them by, random activity. Yeah,
it can happen. After 1 year has passed, your risk is about the same. You have about a 10% risk of re-injuring it down the road. After 5 years, there's really not a lot of difference between not having it had repaired, like a fresh one, and one that's been repaired if it's lasted 5 years. But there is a little bit of a higher risk, about 10%.
Are you basically born with one ACL and one MCL, and if you should ever damage them, it's never the same?
Well, I think it depends on how severe the tear was also. Sometimes those tears are very minor and they can heal on their own without any surgery. But if there has been surgery, of course, then that there's been an invasive procedure, there's been scar tissue and so on, and it may be a little bit weaker in the future. But these days they do a great job with repairs, and people can go on and have great athletic careers. Right. The other thing that tends to happen is the meniscus. That's the shock absorber between the 2 big bones of your knee. Those can be damaged, and when the shock absorber is damaged, that's the meniscus, then you have higher loads that are applied to the bone, and so for meniscal injuries, you will have a higher risk of arthritis down the road.
Well, and Lisa, just keep your head up there, because Adrian Peterson from the Minnesota Vikings blew out his ACL and MCL, came back the very next year and got offensive MVP, so it is possible to be even better than you were. All right, up north we go to Jigo from Tammy, and she says, I've never had any injuries, but my knees and ankles pop a lot when I get up and stretch them. Should I have this checked out?
If you don't have any pain, probably you don't need to worry about it. The popping noise is actually, they believe, is nitrogen being released in your joint. So like people that can crack their knuckles and so on, that's not dangerous. If you hear a lot of creaking, don't worry. If you have pain and swelling, then you probably should worry. And sometimes this is weight related also.
Is that perhaps an onset of osteoporosis or?
Osteoarthritis, sometimes, yeah. If you hear a lot of popping noises and
possibly
stiffness.
Okay. Is this something you should see a chiropractor about, perhaps? Or?
It wouldn't hurt, but usually if there's no pain, no swelling, just ignore it.
Okay. All right, and our last question comes to us from Mingilao, and Joe asks, is it better to treat aching knees and ankles with hot compresses or ice packs?
Great question.
Everybody asks this in athletic communities.
Well, it's mostly whatever feels better. For acute injuries, meaning a sudden injury that you've had, ice is the way to go. The less swelling that you develop, the better for you. So immediate ice, and ice, at least for the next 72 hours. And after surgeries, they, of course, ice it as well. Past that, you have to go a little bit by how your body's feeling. So sometimes if your body feels better with a hot pack on a limb or on a joint, you go with that. Basically, don't do anything that's very uncomfortable. By putting heat, what you're doing is allowing more circulation to come into that area. By putting ice, you're preventing swelling. So sometimes we'll alternate hot pack to ice pack, 20 minutes, like that. So you basically, with the heat, you'll get more circulation going there. With the ice, you'll take away swelling, and that way you'll detoxify and flush out the joint.
All right, very nice. And we'll get you out of here with one bonus question from me. What are some things that you can do, either athletically or just generally speaking, to do preventive maintenance on the knees and ankles, like any exercises?
Super important. First thing, most important of all, is to limit obesity, okay? You want to keep your weight down, because the bigger the load on the knees and ankles, the more they're going to hurt. Then it's really, really important to strengthen actually your hips and your buttocks. And you can go online and look up knee strengthening exercises, and you can see a whole bunch. Also, the Soccer Association has something called the FIFA 11. You can do that if you're training. These are exercises that you can do to make your thighs and your hamstrings and your buttocks really, really strong. Because when they're strong, your knee is very protected, and the mechanism is working really well. From there down to your ankle, same thing, and your feet. So really working on higher parts of your body, thinking not so much of the knee, but the hips and the buttocks.
Excellent. Doctor, thank you as always.
You're welcome. Thank you.
All right, stay tuned. We're back right after this.